About 5 days ago, I went to the emergency room because I was having acute right lower quadrant pain. I went late. I should have went the first day I felt the pain. I waited. And so about 36 hours into the pain is when I showed up at the hospital. They did an ultrasound and told me I needed to have immediate surgery because my appendix had perforated. And now, not only did I have appendicitis, I had peritonitis, which makes it more complicated. I went in laparoscopically, which is standard procedure to remove the appendix, but now they had infection in my peritoneum to deal with. So I woke up from surgery with a disgusting drain coming out of my abdomen with blood and pus entering a bag that I had in for about 24 hours after surgery. I was hospitalized for 5 days and put on intravenous broad spectrum antibiotics, 4 doses a day, lots and lots of antibiotics, which I really needed. And thank God for modern medicine because that was gnarly seeing all of that pus come out of me. I'm okay now and I'm on the other side, but I want to share with you today how I used my medicine and my knowledge to get the best of both worlds with the modern medicine. So get the benefits of treating the infection, surgically removing the perforated appendix, but also doing the work to prevent antibiotic resistant bacteria and also to prevent dysbiosis. So I want to show you what I did alongside the antibiotics to mitigate the effects of the antibiotics on my gut microbiome and to prevent anything hospital acquired or any kind of bacterial overgrowth or dysbiosis that might come from such a high dose of antibiotics, as well as nourish and replenish my gut microbiome when it was in its most weak and vulnerable state. Usually you are just given the antibiotics without a concomitant dose of anything to mitigate the side effects by reducing the levels of inflammation in the gut and helping prevent any kind of bacterial overgrowth and also reducing occurrence of antibiotic resistance genes being transferred, which is another really serious problem that we see. So without further ado, I'm going to get into what my protocol was. The first thing that they gave me in the hospital was these Yakult yogurts, and I think they just gave one on the side of the food that I was already eating. And I was like, oh my God, you guys have this. And let me see if I can say it right. Lactobacillus paracasei. Oh, sorry. No, I said it wrong. They changed the name. Lactocasei bacillus paracasei. And then the strain is Shirota. So this particular version of Lactocasei bacillus is really, really great at promoting the growth of beneficial bacterial species, specifically bifidobacteria, which tends to go quickly under any kind of antibiotic pressure. When you administer probiotics, the most effective way is to start a week before you administer the antibiotics. In my case, I didn't have that choice because it was an emergency situation. I started it as soon as I started the infusions of antibiotics. Every time I would have an antibiotic administration, 2 hours later, I would consume this. I had 4 IVs per day. I think I went through 2 or 3 of these a day, sometimes even doubling up. The next thing I did was L-Glutamine. L-Glutamine is a great one because it is an old school one that we use in naturopathic medicine for a leaky gut. Anytime you have elevated gram-negative bacteria in your gut, which can happen, or you're even just killing off bugs using antibiotics, you can induce leaky gut, meaning the tight junctions of your gut are no longer stuck together. Now there's a little hole and food particles can travel through the lumen of the gut, interacting with the immune system, inducing more inflammation systemically. So what this does is it helps with the gut barrier. Also, I was on Tylenol, which is a painkiller, which can also, unfortunately, adversely affect the gut barrier. So on to the next one. Next one I did was Inulin Phos. So this is not one you want to do if you have SIBO because this one will make you really bloated and uncomfortable. Phos stands for fructooligosaccharides. In general, fructooligosaccharides are not well tolerated in people who have SIBO. Thankfully, I don't have it. This one does make me a little bit gassy, but it's nothing that I can't tolerate. I mean, in general, when you are taking a prebiotic, some are a lot more well tolerated, but in general, you might expect some gas, and it's worth it to me to be able to protect the vulnerable bugs in my gut. There was some research recently where it said if you undergo a course of antibiotics, we see changes in the microbiome up to 2 years after. It's really imperative to protect and feed these guys, and that's exactly what prebiotics do. Prebiotics selectively feed specific species in our gut that are beneficial. So inulin feeds bifidobacterium. It also feeds Akkermansia, and it also feeds something called Faecalibacterium. Faecalibacterium is our main short-chain fatty acid producer. So inulin phos will feed a couple of different genera of bugs in the gut. It will feed bifidobacterium, which is a keystone species, and it's one of the first to go with antibiotics. It also feeds Faecalibacterium, which is a really essential short-chain fatty acid producer. And it also feeds Akkermansia, which is responsible for the mucus lining of the gut. There's a lot of research more recently about how Akkermansia is a GLP-1 promoter, so it helps with insulin sensitivity and things of that nature. So inulin was a great one to have on board. I was doing it again, kind of similar timing in terms of dosing in between the antibiotic administration. The next one that I was using is Saccharomyces boulardii specific strain CNCM I-745. Now, this strain of Saccharomyces boulardii, you don't want to just get any Saccharomyces boulardii, and I think this is where a lot of people might not be aware, is that you should really make sure that your probiotics are strain specific. So if it just says Saccharomyces boulardii and it doesn't show that it's this researched strain, then I wouldn't bother with it because there are so many different strains. The strain will have completely different activity in the body. The way that they select these probiotics doing research is they have all of these criteria. So the ones that are actually well researched and well established have the ability to survive the pH of the stomach, have the ability to colonize at least for a small amount of time. We know that probiotics don't really colonize for a long period of time, but there are specific criteria that have to be met. So you want to make sure when you're doing a probiotic that you're actually getting the one that you know has been studied to work. So this one is amazing. Primary use is for antibiotic-assisted diarrhea. I used it for more than that because it also works as a temporary placeholder. When you're taking antibiotics, you're killing off a lot of the beneficial bugs. If you think of a parking lot, now you have a bunch of open parking spaces. And more inflammatory bugs, more proteobacteria-like bugs can come in and take those parking spaces. But not if you use probiotics. They come in and they temporarily take the place. And while they might not colonize, they are doing a lot of other things while they are there in that parking space. So with this strain, we see enhanced mucosal immunity by the production of immunoglobulin A or IgA. It can also take the place of bad bugs and prevent them from colonizing. It can also prevent the translocation of antibiotic resistance genes. So this is a really great one to be taking in between your antibiotic doses. Next up, we have Lactulose. This is a particular brand named Dufalac. Lactulose is an interesting one. It is also contraindicated in SIBO cases because it can feed the microbes that are producing symptoms in SIBO and often is one of the main substrates that's used to do a SIBO test. But with this particular prebiotic, it works wonders. It specifically feeds the short-chain fatty acid producer, so like your Faecalibacterium, for example, and in turn, it acidifies the colon. When it acidifies the colon, bad bacteria are not able to thrive in that environment. So the more alkaline your colon, the more of a problem bad bacteria are. So we're feeding the good species, we're preventing the colonization of bad species or the more inflammatory ones. It's also going to prevent against the absorption of something called endotoxin or lipopolysaccharide. This is a gram-negative bacterial toxin that we often see in species like Pseudomonas, which is what I had colonized in my peritoneum. So this one is really, really awesome to use. Careful in SIBO. It's a laxative in higher doses. You really need to figure out what the right dose is for you, and that's kind of person dependent based on tolerance. Generally, I start low and slow and work up from there. The last thing I used is N-Acetyl cysteine, good old-fashioned NAC. NAC is a precursor to glutathione. So glutathione is an antioxidant. NAC is hepatoprotective or liver protective. So taking things like Tylenol and antibiotics can really do a number on the liver. And NAC is a great way to protect the liver. Another thing that NAC can do is disrupt biofilms. So if you have a bacteria that is producing biofilms, NAC can be supportive in that. So I hope this video was helpful. I hope that you learned something today. Now, there are a number of different things that you could do in this case. This is just what I had available to me, and I think it's actually quite a wonderful combination of things that have worked synergistically with the conventional treatment. Surgery was necessary, antibiotics were necessary, and I wasn't about to leave it there and leave my gut up to chance. I wanted to take control of my situation. And again, in these circumstances with pre and probiotic administration, specifically probiotic administration, starting the probiotics before the course of antibiotics is really the best way to do it. And then the second best way would be to do the probiotics during the course of antibiotics and after, or the third best way would be to just take them after. So if you really want the best outcome in an ideal world, you're taking the probiotics before, during, and after. And usually that's about 7 days before, 7 days after, or even up to 14 days after. I plan on taking this 2 weeks after my last antibiotic dose, and maybe even beyond that because it can't hurt, right? So let me know if you have any questions in the comments. Until next time.